What's missing in cardiovascular healthcare? Well, a lot for everyone of all genders. Previously, I covered several ways that conventional cardiovascular care is missing the mark in treating heart disease. For example, medicine is not factoring in individual and gender differences that increase one's chances of a cardiovascular event. The personalized aspects need to be considered to assist in forming an integrative, personalized, and precise wellness protocol for cardiovascular health and for prevention. But even with all of this information, it isn't possible to fully achieve truly holistic heart health. Relationships, socioeconomic status, and emotions are even more essential for healing the heart than any drug, supplement, or lifestyle intervention that only addresses misaligned biochemistry. In fact, perceived isolation is the number one risk factor for cardiovascular mortality. Furthermore, healthy relationships buffer the negative impacts of a heart attack. And mental health is also linked to heart disease, and that's eased by feeling connected to others. So, to put it simply, love is the medicine needed to heal hearts globally. It boosts all other things that we're doing to optimize physical cardiovascular function and overall health. In this video, I'm going to review more about this heart-brain link, and it's critical to understand to heal all of the struggling hearts on Earth. We're going to go over the heart of medicine, the heart-brain link, heart connections in an epidemic of loneliness and isolation, the power of relationships on heart health, feeling social connections in a disconnected world, and tips for integrating more love and connection to healthcare using naturopathic, functional, and integrative medicine, one of my favorite topics. All right, let's get started. I'm Dr. Sarah, and the video resources as well as the links to previous videos, if you missed the first two in the series, on the cholesterol controversy, the statin controversy, and then the differences in risk factors for men, women, and different genders, and what's also under-recognized. Those two videos links will be in the video description as well. So go ahead and check those out if you want more information or just to catch up and get more details. But let's go ahead and get started on the heart-brain link. Now, there was an article review on the psychological factors. So we're talking about mind-body factors that linked to cardiovascular disease. And they found that several did, and these included stress, anxiety, depression, social isolation and social support, psychosocial work environments, acute and chronic life events, and personality type and hostility. Those all increase the risk for a cardiovascular event. Now, interestingly, stress, mental health, and relationships were the strongest associations between the brain and the heart. And the authors reported specifically in their research that depression was an independent predictor of heart disease, that anxiety, stress, lack of social support, and psychological work characteristics were linked to coronary artery disease, that the research on hostility and type A behavior was inconsistent. So we've probably heard a lot how these stress typed and type A behaviors are linked to heart disease. They were saying that the literature was mixed on that. And that could have to do with perception, right? How people perceive the stress and how they perceive themselves as they're working in this type A kind of a manner, okay? And then the role of chronic life events is likely to affect heart health, but that is hard to measure. So one of the reasons that I think a lot of this gets swept under the rug and it isn't necessarily in the forefront for medicine is it's hard to measure and it's hard to treat. It's much easier to give somebody a drug to manipulate the after effects of some of these impacts than it is to actually go forward and actually look and ask people about some of these tough questions about relationships and their feelings of being isolated. Now, the strong role of social support is the number one predictive risk factor for heart disease. Let me just give you some of the statistics that this review article, and again, the link will be in the video description, what they stated about this link. First of all, it was one of the major protective factors for cardiovascular heart disease and social support. Some studies even shown that perceived social support during hospitalization decreases depressive episodes in later months. So you also have this dual effect, right, of buffering for coronary heart disease, as well as for decreasing the role of depression, which is also associated with heart disease. Many studies have shown that heart attacks or myocardial infarctions of depression, the amount is linked to the amount of social support. So the rate of depression, let me say that again. Many studies have shown that after a heart attack, the rate of depression depends upon the amount of social support. So that's just another way that the authors were saying that. The study also showed that different types of stress, such as anxiety, depression, social isolation, and social support, acute and chronic life events, hostility, and type A behavior, which I discussed before. But among these behaviors, social support is more important than any other variable. Not only is a lack of social support associated with the occurrence of cardiovascular heart disease, but it's also an independent risk factor for mortality or death. Very important buffer. Now, recently, the Surgeon General, Dr. Murthy, if you're watching this in 2023, he released the U.S. Surgeon General's advisory on the healing effects of social connection and community. It was his report, and it was pretty long, but he did state that loneliness poses health risks as deadly as smoking up to 15 cigarettes a day. He stated that loneliness increases the risk of premature death by nearly 30%. And it revealed that those with poor social relationships had a greater risk of stroke, heart disease, and that isolation also elevated a person's likelihood for experiencing depression again, anxiety, and dementia. What are our biggest things right now that we're under for a crisis, right? Mental health crisis, anxiety, depression, and also the number one risk factor for death, or the number one cause of death is heart disease. And they're both direct. They're all directly linked to social support. He said that there's no substitute for in-person interaction. So we're shifting to this technology more and more for our communication. What's happened is we've lost our actual in-person interaction, and finding a way to balance technology that also strengthens our relationships as opposed to weaken them was something that he did touch upon in the report, and is something that I think we're all trying to balance a little bit more. I think it's easy for people to substitute maybe some Zoom or maybe some social media for actual human interactions. And what that does for our brains and bodies, biochemistry, as well as for our mental health, isn't the same as when you're around someone and actually being in their presence. Now, the Center for Disease Control and Prevention, the CDC, also stated some statistics. And again, they did come out with say it's hard to measure, but here are some of the things that they came up with. That again, they were saying that social isolation increased a person's risks of premature death from all other causes, and it rivaled smoking, obesity, which I hate that word because there's stigma attached to it, and physical inactivity. It was associated with about a 50% increased risk of dementia, poor social relationships that's characterized by isolation or loneliness. It was associated with a 29% increased risk for heart disease and a 32% increased risk of stroke. Higher rates of depression, anxiety, and suicide were also associated with loneliness. And among heart failure patients, it was associated with a 4-time increased risk of death. 68% increased risk of hospitalization, and 57% increased risk of emergency department visits. So again, this is a major risk factor, and it really, as I stated in my other videos and in my other articles on this topic, really isn't being brought to the forefront when we look at risk factors, and it's the number one risk factor that we're completely not giving as much attention to. Again, it's easier to talk about high cholesterol, lifestyle factors, genetics, diet, all of these different things that we can manipulate. And I'm not saying those aren't important, and those do have a very important place in cardiovascular disease. and prevention, obviously. But again, if we're not looking at what buffers this and what helps people recover and actually heal and nourish their heart, which is relationships, we're missing the mark. Now, there's different ways that social connection affects our aspects of health. And this includes biological factors, right? Social relationships help buffer stress hormones. They effectively and more beneficially modify gene expression, and they lower inflammation if they're healthy relationships. Psychologically, give people meaning and purpose, right? Who doesn't want to do things for someone they love or for their children? Decrease stress again, helps up feelings of safety and security and resilience and hopefulness when we're in healthy relationships. And this is really good, not just for our mental health, but all of those different feelings actually create biochemical mediators from our brains that go to our bodies and optimize our physical health as well. And then when we're in healthy relationships, we want to take better care of ourselves because it's important for somebody. We understand that it's important to somebody else that we feel good so we can be present for them. So things such as smoking habits, exercise, and how we rest, how we nourish our bodies, all of those are influenced by positive social interaction. So how do we get there? The Surgeon General's report did have a list of 6 foundational pillars. It started with social infrastructure, public policies at the level of the government, including things like accessible public transportation or paid family leave, so people could spend more time with their families when needed be. Mobilizing health sectors across medical needs that stem from loneliness, right? Like if doctors are in cardiovascular and heart health care and they're not asking about relationships, again, missing the mark again. And then reforming digital environments to evaluate people's relationships with technology, because remember, there's no substitute for actual in-person interactions. Deepening our knowledge for information about this issue, which is something I'm hoping that these videos are helping you to understand, and cultivating more a culture of connection. Right now, we're in a culture of division. So the more that we can accept one another and listen to each other rather than cut people off, which is the trend right now. If people don't like what other people say, they tend to just stop talking to them. I'll just give away my age a little. I'm a kid of the 80s and 90s, and we used to have conversations with people and discuss and try to learn from other people who might have different political or other beliefs or medical, viewpoints, and they were still our friends. And unfortunately, that isn't true today. So what's happening is important relationships are being tossed aside for different beliefs that are being construed as more important values than maybe need be, so just something to think about. Now, the national strategy calls on individuals, organizations, and communities, going from the level again from governments, health workers, public health professionals, researchers, philanthropists, schools, workplaces, community organizations, technology companies, media, parents and caregivers, and individuals. It's a really good comprehensive report, and it really lays down again what a huge issue is right now in healthcare. And I think stressing isolation and relationships, how important those are for our physical health outcomes isn't really new to integrative practitioners, right? This mind-body link, but it's a good way for conventional medicine to start seeing this and implement it. So that brings us to the naturopathic, functional, and integrative approaches to heart health. So we've gone through this heart-brain link and these associations, how social connection is important for heart health and how it buffers negative events. And then we've talked about social support, specifically how it affects behavioral, psychological, as well as physical aspects of health. Now let's talk about what we can do about that. Now, obviously, we want an integrative heart health approach, right? So we need to address traditional risk factors, nutrients, movement, lifestyle choices, high lipid levels. Those are all important. But again, they only partially impact heart disease outcomes if we don't address the underlying causes. So if we treat high cholesterol with a statin, that's good in the sense that it will get down cholesterol levels. There'll be less a chance of a cardiovascular event, likely. But again, we have to weigh the risk versus benefit. And what if it's related, high cholesterol levels are related to an infection or inflammation or a low functioning thyroid? If we artificially just decrease cholesterol levels and don't look for the root cause, we could potentially be preventing one thing at the expense of causing something else to be, another issue down the road. Thyroid disease, autoimmunity, potentially, or some other form of inflammatory condition. So we need to look at the underlying causes, which is one of the things naturopathic and functional medicine docs focus on. We don't just look at the symptoms of, like, say, high cholesterol or some of these risk factors. We look at the why. Why is someone not nurturing their bodies as well as they could be? Why is somebody not nourishing their brain and body? Maybe they just don't have the information. Maybe there's trauma there. We need to go into those aspects. It's really the heart of medicine. So how can we do this? How can we incorporate this into medicine? There's a couple things I thought of. First of all, to, as was stated, discuss and assess social support for every client or patient that comes into a doctor or a healthcare provider or wellness provider's care. Specifically ask about those social connections, have available referrals to community resources for programs or groups that enhance connections and where people can meet up and maybe share some interests. Other things that we can do is to recognize on a broader level in medicine the efficiency and wellness benefits of the mind-heart-body connection on cardiovascular outcomes. So it's been demonstrated through different applications and different research studies how stress and coping techniques, mindfulness, mind-body approaches, research from the HeartMath Institute, and different effects of things such as essential oils on biochemical, psychological, and emotional influences, how all of these factors positively benefit heart health, right? And different factors that incorporate to make somebody's cardiovascular system more resilient. We also don't want to be closed-minded in science and look at the fact that for years, we have been having heart disease as the number one killer. And a lot more people are on statin medications and getting treatment, maybe not as many as arguably there should be. But I'm going to say I don't think it's a statin deficiency, and I don't think it's a supplement deficiency either. We need to embrace new philosophies and look at the whole picture, such as what was presented by Dr. Cowan, which is controversial, but he did look at the heart as being more than a physical pump and looked at some of the energetics. And we know, as we measure EEGs, that the heart does have an energetic component, right? We also want to factor in the role of blood type, of genetics on cardiovascular risk, of course, but also the epigenetic factors, such as how lifestyle, stress management, and nutrition can mitigate some of the harms caused by these higher risk factors. We want to implement personalized interventions for triggers and mediators related to heart dysfunction and address the whole person using, I say, a naturopathic and functional medicine approach, but really what we're coming in as is how do we look at the whole person and how everything's connected? So it's any form of health approach, right? And then utilizing and incorporating mind-body practice into medical education, all types of medical education. And at every visit, doctors, are starting to talk about stress. They should also talk about mind-body approaches and social support and how people can have a better relationship with themselves and with others. Now, essential oils are obviously one of my favorite tools. They're easily accessible, and they can be used to promote emotional resiliency, stress relief, and hormonal balance. Once all those things are optimized, it creates better intimacy skills and healthier hearts. So again, just to summarize and kind of put this all together, addressing traditional risk factors, expanding awareness on overlooked symptoms, and integrating holistic treatments for all the mediators in heart health are important, but not enough. We need to embrace more love and connection into healthcare. As individuals and health professionals, it's my wish that we can take this information, empower ourselves, and begin to create a healed, healthy world. We need to start somewhere, right? So every little action that we do, if you're a practitioner asking more about social support at your next visit, if you're an individual taking some of this information and maybe moving more from things such as, technology to actually going out and seeing some friends and loved ones, just little things that we can do on all different levels are going to add up in a big way. All right, so thank you for watching. I will have some information on upcoming programs, and even a community membership is on the way, where you will get access to me for questions and answers and more personalized connection. So be sure to be on my mailing list if you want all the updates about that. There's also a ton of resources available on my resource page. Links again in the video description, so make sure you scroll down. If you like this video, I appreciate it if you like it and share it, because this is how I can keep this free information going for you so that more people can take better care of their hearts, their brains, their overall wellness. I appreciate you for taking the time, and I will be back for another video, so stay tuned and make sure you sign up again for my newsletter to get all the updated information. Take care.